Hello, this is a virtual pathology specimen of the upper aerodigestive tract, and the diagnosis is metastatic lung carcinoma to the regional lymph nodes of the lung. Let's orientate ourselves. We are looking at the posterior view now. Here is the tongue, the epiglottis, the trachea, and we have some very large paratracheal lymph nodes and also subcarinal lymph nodes. This shows the anterior surface, and over here is the thyroid cartilage, and the thyroid gland is in this area. These black areas here are actually part of the lung parenchyma that have been dissected of the larger airways. So the obvious pathology is in the lymph nodes, and this is a very large upper paratracheal lymph node. The rim of black suggests that it contains a lot of carbon, so this is an anthracotic lymph node, but we can see that the parenchyma is tan and very solid and fleshy looking, and this is because it is almost completely replaced by a metastatic tumor deposit. Similarly, in this region, we can see the subcarinal lymph nodes, and again, the lymph nodes are enlarged. There are some paler areas that look quite friable with some material that appears to be dropping off. And again, these are lymph nodes involved by metastatic carcinoma, and these paler areas represent areas of necrosis. Here you can see the remnant lung parenchyma that is extremely anthracotic and blackish in color. As we rotate this specimen further, we can see another lymph node here, and again this lymph node is enlarged. Notice that it's also very round in shape, and usually a round shape of lymph nodes indicates a pathologic lymph node. So again, we can see the fleshy tan metastatic tumor deposit, and there is some anthracotic lymph node parenchyma as well. Let's take a quick look at staging of lung cancer. Here we can see a snapshot of the virtual pathology specimen with the opened trachea and the paratracheal lymph nodes and subcarinal nodes. The classification of regional lymph nodes is according to stations, and they are numbered from 1 all the way to 14. So for example, here station 1 includes lower cervical, supraclavicular, and these may be palpable in the patient, and also sternal notch lymph nodes. And then station 2 is upper paratracheal, station 4 lower paratracheal, so on and so forth. And over here I've also highlighted the subcarinal lymph nodes, which are station 7 lymph nodes. This, by the way, is the clavicle. So in the staging system, the AJCC staging system for lung cancer, of course, there is a PT category, which is for the tumor, and this goes by tumor size as well as whether it has invaded into adjacent structures such as the pleura and the chest wall. For the nodal category, you can see that the parameters that are evaluated include the location of the lymph nodes, peribronchial, hilar, intrapulmonary, etc. And the stage is higher the further away the lymph nodes are. And for the metastatic category, you may also notice that lymph nodes that are not in a regional location, which means they are not in the stations 1 to 14, these are actually considered metastatic disease. If we superimpose our specimen picture onto this diagram, we will see that likely the level 2, potentially level 4, and definitely level 7 lymph nodes are involved by metastatic carcinoma. Hence, in summary, this is a virtual pathology specimen of metastatic lung carcinoma involving the paratracheal and subcarinal lymph nodes. This fully interactive and labeled virtual pathology specimen is part of our free online pathology resource, Pathweb. Scrolling down, you will see additional useful information, including gross and microscopic images, as well as other videos. Registration is free, and the link is provided in the video description. Thank you.